guess what? Our healthcare situation is a catastrophic problem, and there's nothing pragmatic about an incremental solution to a catastrophic problem. We're going to go to Tennessee now to look at another story, and this is something in regards to our system and how broken it is. This is going on in Tennessee. At least 220,000 Tennessee children face loss of health insurance due to lacking paperwork. Tennessee's Medicaid program insures more than 1 million people, mostly children. For years, TennCare relied on an outdated, paper-heavy process to determine eligibility, and this system was rarely able to determine if kids were actually eligible. When the leukemia was finally gone, Tricia Sewell thought her family's nightmare was over. It was October of last year. Sewell's 5-year-old son, Abel, had just finished 3 years of chemotherapy, all of which had been covered by Tennessee's state Medicaid program known as TennCare. Chemo was successful, but now Abel needed monthly blood tests to check to see if the cancer ever came back. At the doctor's office, something went wrong. The staff discovered Abel's TennCare had vanished. His mom paid out of pocket for the blood test. Then she'd realize she'd have to pay again next month. So this is what happens when you have an underrepresented and an undersupported system because of the way our current system works. The way our current system works is that they're trying to hand it all away to the insurance companies. That's what they're trying to do. And that's why just John Delaney's plan will not work. Joe Biden's plan will not work. This whole plan that allows the for-profit insurance companies that are wrecking healthcare. They're not providing health. They're wrecking the idea of it to pad their own pockets. 45,000 people die a year because of lack of adequate healthcare. It's because our system's broken. We need to reinvent the wheel. We need to redo our system so something like TennCare doesn't rely on outdated paperwork to do this. So that it's a stronger system that insures everybody. And the goal of said system is to insure everybody, not one human being excluded, and to have a healthier populace. The goal of the system is not to make money. And people are going to look at this and they're like, well, stuff like this happens because government. No, stuff like this happens because we have a system in place that favors for-profit insurance companies while neglecting everything else. And we've surrendered our health insurance and our health coverage to these entities. That's why stuff like this happens. And in a Medicare for All single-payer system, it reinvents the wheel. Which, by the way, every other industrialized nation does. Which pretty much every other industrialized nation does. But in the meantime, stuff like that can happen. Where a child with cancer, their TennCare just vanishes. Their Medicaid just vanishes. So now that family has to turn to the private sector where they're going to get screwed. Or they just got to go out of pocket, as the mom was doing.
Get your news on with Ron. Don't you want to know what's going on? We're getting our news on today. Get your news on with Ron. Don't you want to know what's going on? We're getting our news on today. You can tweet me an article at Ron Placone. We'll go through it together